Good afternoon, everyone, and welcome back to the second session of our 2020 Texas Benefits Forum series. I hope those of you who tuned in for yesterday, or Zoomed in, I should say, enjoyed session one that was on 2021 benefit strategies for the new normal and came away with some useful insights for your own company's benefits planning. Today's program will focus on obesity and related chronic conditions and why it's so important to manage obesity, especially during the COVID-19 pandemic. The session will be presented in two parts. Part one will focus on the burden of obesity and the benefits of obesity management. And then we'll segue into part two, which explores some innovative high-tech, high-touch approaches to managing obesity and the chronic conditions related and at-risk employee populations. So we're very grateful to our sponsors who are making it possible. As you can see here they are. They're making it possible for us to offer this educational program to Texas employers. And in appreciation, we've invited each sponsor to give a 3-minute highlight overview of their company and some of the useful resources that are available to employees through the Texas Business Group on Health. Today, the spotlight will be on Novo Nordisk and Sanofi. Yesterday, the spotlight was on AbbVie and Pfizer. So each, we have 8 sponsors. Each one gets a sponsor showcase. We'll do that after the first segment of the program. Part one is completed, and we switch over to our other speakers in part two. So let's begin with the first part. This is session 2, the burden of obesity and the benefits of obesity management. And I'm so pleased to welcome Dr. Natalie Hartenbaum. She is the president and CMO of Ocumedics. It's an occupational medicine consulting firm in Dresher, Pennsylvania. So I'm so glad that you can do this virtually. It would have been challenging to come in person for an in-person one, I bet, with the way travel is going. Dr. Hartenbaum is certified by the American Board of Internal Medicine and the American Board of Preventive Medicine and Occupational Medicine. She is also a medical review officer and has extensive experience in clinical, corporate, and academic settings. And she's a nationally recognized expert in occupational fitness for duty with a special focus on transportation, which is interesting because many of our members who are probably tuned in today have a lot of transportation employees, especially the municipalities that have the bus drivers, the firemen, the police, and all of the other the garbage collectors and everybody else who's busy driving and has to meet the job requirements. So, Dr. Hartenbaum, would you like to begin?
Thank you very much, Marianne, and thank you, everybody. Hopefully you can hear me well. First of all, I apologize for not being able to be there in person. I know this is quite a bit different you don't see my picture as I'm speaking. You saw a picture earlier. I do look kind of like that, just a little older. But I have been having, as many of us may have experienced recently, Zoom challenges when I add a video to go along. So I thought this was just going to be a safer bet. Do want to first of all just state that I am a paid speaker. I am speaking on behalf of Novo Nordisk this afternoon. And because of time constraints, I won't be able to take questions, but Tom Zabasky from Novo Nordisk will be involved in the sponsor showcase, and he can take those questions either in the chat box, or if you forward them to him, he can make certain it comes to either myself, or if I'm not the right person to answer those questions, which there might be some, he can make sure it gets to the right person. So as Marianne mentioned, I'm going to be talking a bit about the burden of obesity as well as the benefits of obesity management. If I can have the next slide. Before I go too far, I just want us to all be on the same page on obesity. I really think that by now we probably are. I certainly hope so. But for many years, the expectation, the understanding, the assumption was that obesity was more of a behavioral problem. And we really do know at this point in time that obesity is complex, multifactorial, and it is excess body fat. It is a chronic medical condition. It is not a treat it once and forget about it. It requires ongoing care, ongoing support. And obesity, unfortunately, can really lead to complications, can lead to other diseases, can make other conditions difficult to treat properly. And those comorbidities are ones we need to really keep in mind as a downstream effect of inadequately treated obesity. And we'll talk about that in just a little bit. So if we can, again, just think about obesity. Obesity is measured, we talk about it by a BMI, a body mass index, and a significant number of the adult U.S. population, 70%, are either overweight or obese. Just keep that number in mind when we're looking at that impact on your bottom line. If you have that many employees that have this chronic condition and they're not diagnosed, which is a big problem, or they're not treated, it really is affecting your productivity and your bottom line. So that's really what I want to focus on this afternoon. Next slide, please. So talk about comorbidities and risk of obesity. Comorbidities, what medical conditions are associated with obesity? What do we see happening at a higher incidence? What medical conditions do we see are more difficult to treat if the individual is obese and is not adequately treated? And then what are those long-term effects? Now, a lot of what you were thinking is probably, oh, health insurance. But also think about health costs. Think about productivity. Think about presenteeism. Think about recovery. Think about workers' compensation. So all of these medical conditions and obesity really can impact. So think about your ROI. Addressing the problem will help your bottom line. Next slide, please. Now, as we look at this beautiful figure, just kind of looking at all the different organ systems, the different parts of medical conditions that can be affected by obesity. As I've heard already that a number of you have transportation operations, sleep apnea, obstructive sleep apnea is an area certainly special interest of my own, but certainly can cause a lot of other complications, the microsleep, the safety concerns. And then you have the asthma and the COPD. Alcohol is not the only thing that can cause liver problems. Obesity in and of itself can cause some significant liver problems. Diabetes, the harder to control the diabetes, the harder it is to keep the person safe at work. Venous stasis disease, and on the right-hand side, we pop over to cardiovascular, including hypertension, congestive heart failure, arrhythmias. Cancer, numerous cancers have been associated with obesity. And then going down to the very bottom, you have your degenerative joint disease and gout, and we'll talk a bit later about the impact of osteoarthritis, the risk of needing surgery, the delay in surgery recovery, and sometimes it's the real difficulty in getting someone who has obesity, has a musculoskeletal problem, and getting them back to work, because it really can make recovery that much slower. And now the one thing which I don't have on this slide, but I will mention as we talk about, is COVID. Clearly, we're all dealing with COVID right now. And unfortunately, it is actually very accurate, and it's been seen worldwide, that those individuals who are obese have a much higher risk of having more severe disease when affected by SARS-CoV-2. So while we may not want to think that, okay, we treat them for obesity today, we're going to solve our problem tomorrow, but there will be another infection, there will be other pandemics, and a lot of individuals who are going to get any significant medical infection disease will be at a higher risk of having more complications if they are also obese. So keep that in mind when we're looking at what are some of that benefits of treatment. Next slide, please. Now, risk. Look at the numbers on the left-hand side. Diabetes. Interestingly, men and women have a different increased risk of developing type 2 diabetes from obesity. So it's 12.4 times the likelihood of getting that diabetes, 2.4 for women, for hypertension, 1.8 times for men, and then coronary artery disease, 3.1 times the risk in a woman who's obese than in a woman who is normal weight. So women may be more concerned, but it's really important to recognize that they also have that much higher risk of having those complications. And it should be addressed in both men and women, but we can look at the statistics and know we can't ignore anybody. Next slide, please. And I mentioned earlier the osteoarthritis. The joints are going to get worn down. They're going to get worn down that much faster if the person's putting a lot of stress on it because they're carrying that excess weight. The worse the osteoarthritis, the more likely they're going to need to go to surgical intervention. The more likely they have to go for surgical intervention, the larger they are, the harder it is for the recovery, the higher risk of postoperative pain. and looking at both knee replacements and hip replacements, 2.5 times more knee replacements, 1.7 times more hip replacements. So address the problem early, and you can decrease the risk of these complications, these problems, these comorbidities as you go down the road. Next slide. And I keep talking about down the road. Well, this is, again, not a treat it one time and it's good and you can keep on going forever and ever. But as you look at that 5-year burden, congestive heart failure more than doubles over 10 years. Diabetes is one of the ones that doesn't actually increase risk over 10 years. But myocardial infarction more than doubles, stroke risk more than doubles, and osteoarthritis more than doubles. So the longer the individual has obesity, and the longer it takes to get the treatment, the longer it takes to address the problem, the higher that risk will be, and the more likely those comorbidities will turn up. So you probably already have the start of that obesity problem in your workplace. It probably is already impacting your employees, but if we don't do something about it now, in 10 years from now, you can see the numbers, how likely they are to be at risk of having any of those problems. Next slide, please. And then again, it's just good old life. What happens to obesity? Does it shorten an individual's life? The earlier you address the problem, the less years will be lost. If you look at the age 20 to 39, individuals with obesity greater than 35, 8.5 years for men, 6.1 years for women, early death. So the earlier we do something, the better off we are. However, even if we're waiting till people are 40 to 59 or even 60 to 79, it's not too late to do something. Next slide. And then just overall functioning. Individuals with obesity, when you look at something called the quality of life measurement, their quality of life is different. And those that are severely obese, a BMI of greater than 40, have almost a 20% decrease in quality of life. They have significant physical limitations, walking, dressing, bending, exercising. If they can't do all of those activities well at home, they can't do those same activities well at work. They can't climb into a vehicle. They can't load. They can't unload. They can't work machinery well. And the more at risk they are, the more likely they are to have a workers' compensation injury or to injure themselves either at work or at home. So if we can go on to the next slide again, please. And this is where I want to spend a little bit more time, which I think is important. We don't recognize it. We don't recognize that obesity is a medical problem. And obviously, if you don't recognize it, you can't treat it. If you can't treat it, you can't address the risk. You can't address the comorbidities. You can't prevent the complications, the problems that you're going to see as you go down that road. So let's go to the next step. Okay, just some data really showing 90% of people who have obesity have never received an obesity diagnosis. Can you imagine someone walking into a doctor year after year after year with a blood pressure of 160 over 100 and not being told that they have high blood pressure? Or someone who has their blood sugar checked and they're found to have a blood sugar of 200 and the provider never says to them, oh, you have diabetes or you have metabolic syndrome or you have something. But 90% never are diagnosed. And in many cases, a provider should be able to just look at the individual and suspect that there's probably something going on. Survey of 1,200 primary care providers. Less than 50% always provided advice on diet, exercise, and weight control, whether obese or not. Better to address the issue earlier, better to prevent it, not mentioned. And then when we look at those individuals who met the criteria for obesity, only 4.9% of their office visits were directly obesity related. So the problem that we have is that even the healthcare providers aren't addressing it with their patients. Next slide, please. Now, who's to blame? Who's at fault here? And this is a really interesting survey where 61% thought that obesity was just a risk factor. Only 38 recognize that it's a medical condition. It needs to be adequately treated, whether it's diet, whether it's exercise, whether it is surgery, or whether it's an anti-obesity medication. Is it a lifestyle choice that they're eating too much and they're not exercising enough? Or is it other things? Is it environmental? Is it genetic? Is it societal? 48% said, no, it's just, not exercising enough, eating too much. Truth is, it is a multifactorial disease that is often beyond just the control of eat less, exercise more. And then when you ask that question of, when it comes to managing your weight, do you have complete or quite a bit of control? Those without obesity, 68% felt that the person who's obese has a good amount of control, and almost puts blame on those individuals. You should be able to handle this on your own. And I know other speakers this afternoon will point out the same thing. This is not something that you can just look at someone and say, you have obesity, eat less, exercise more. It's much more complicated than that. But even those who recognize that they are obese, 41% of them, only 41%, or I should say 41%, still think they have a lot of control over it, which they don't. It has to be part of a bigger process to take care of addressing it for the condition itself, for the obesity, but just as importantly, if not more so, all the associated comorbidities and long-term complications. If I can have the next slide, please. Now, the first step in treating obesity is the individual has to recognize that they have a problem. So healthcare providers are going to talk about obesity if the patient walks in and says, hey, doc, I'm concerned. I know what my BMI is, and I think, or I know my pants aren't fitting me right. But this is not meant to be an optical illusion. All three of these gentlemen are the exact same body mass index, the exact same weight. And when you ask that individual who is obese, who has a BMI above 30, if they think that they're obese or not, 9% say, I'm fine. 47% think that they're overweight but not obese, even though technically they do meet the criteria for obesity. And then only 43% say, yeah, I'm obese. Maybe I need to do something about it. So if I can go on to the next slide. What would be great is if the healthcare providers would start that conversation. If the healthcare providers would turn to somebody who is known to, or is recognized. Everybody walks into their healthcare provider. One of the first things they do is get you on a scale. They take your pulse and your blood pressure. So they know what your weight is, and they should be able to easily calculate that BMI. But most physicians have limited knowledge on the pathophysiology, what causes obesity, the genetic factors, the endocrine factors. There's many factors that are beyond the individual's control. Most physicians were never taught this and aren't really aware of what obesity is and how it's what causes it. Many don't understand all the options available. And if the healthcare provider doesn't think about asking if their person's obese, if the individual doesn't think to ask their healthcare provider for advice, the healthcare provider is not going to go ahead and start having that discussion unless a third of physicians actually have any confidence in actually treating that obesity. So when we look into the little graph on the right-hand side, we see those patients walk in BMI of greater than 30. They have obesity. 26% get the diagnosis, 17% may get diet and exercise or diet advice, 14% get education, and only 9% are really educated in weight loss reduction. That's a significant problem when the healthcare providers aren't sure what to do. Next slide, please. All right, so we know that the individuals who are obese don't really recognize that they have a problem. We know the healthcare providers don't think to ask, don't think to advise, don't think to give guidance, and don't think to treat. And now we have the patients themselves don't want to go talk to their doctor about it. More than a third will not talk to their healthcare provider about their weight. Some of them are embarrassed. Some of them are I feel shameful. Many of them feel like it's my fault. I should be able to do something about it. And as I keep on saying, it's not just a eat less, exercise more. It is a multifactorial chronic condition. And they don't want to have their doctor say, go ahead and you got to lose weight. Well, doctor, tell me more. So they just don't even talk about it. Next slide, please. I mentioned earlier, what happens? An individual walks into their doctor's office, they get a urine dip, there's sugar in the urine. They get a blood sugar, it's elevated. The doctor treats them. So on the left-hand side, you see diabetes. How many people have diabetes indicated when they walk in there? 8.4%. So 86% of those who need treatment for diabetes will get it. Where treatment for obesity is indicated, only 0.9%. Significant gap. So we're back to that unrecognized, that it's a problem, and unknown of what do we do, how do we address the issue. Next slide, please. So benefit, why, hopefully I've given you at least some background of all those things that are affected by obesity if it's not recognized. If it's not recognized, it can't be treated. Well, what kind of good things can we see happening if we identify and treat obesity? Next slide, please. It doesn't take a lot, 5 to 15% of weight loss, which is not a tremendous amount, but it can make a very, very significant difference in hemoglobin A1C, which is a measurement for diabetic control, can make a difference in blood pressure, can make a difference in sleep apnea, it can make a difference in osteoarthritis, can make a difference in lots of other conditions as well as quality of life. It allows the individual to be able to walk more, to do other activities more without having problems. And while lifestyle therapy, to eat less, exercise more, other behavioral changes must be a part of obesity management. For most individuals, it is not going to be enough to reach that 5 to 15% of weight loss to really make a difference as a great start. Next slide, please. And then healthcare costs. Individuals who lose more weight will do better. And if we start down just from a pure financial perspective, for year one, if they've lost greater than 10% of their body weight, $193 savings. If we go on to year two, that's sustained, close, $185 in decreased healthcare costs. So, but it has to be continued treatment. It can't be a one-time treat and then we're done. It has to be an ongoing recognition, ongoing activity, ongoing event to get the individual to go ahead and lose weight. Next slide, please. Now, does your plan, I'll talk a little tiny bit about benefits and healthcare plans, but the bottom line is you really need to talk to your insurance broker. You really need to talk to whoever's providing the healthcare. There are three major categories of how obesity can be treated. Talk again about them in a couple of slides. But diet and exercise, pharmacotherapy, and surgery. Individuals between 25, the overweight category. If they have some comorbidities, yeah, you want to think about diet, exercise, maybe the other treatments aren't really appropriate for them. But as you go up in the BMIs, they become more obese, going from class 1, class 2, class 3 to severe obesity, that diet and exercise. But then if they have some comorbidities, they have heart disease, they have high blood pressure, if they have even osteoarthritis, if they have diabetes, if they have obstructive sleep apnea, consideration should be given to adding on the anti-obesity medication. Certainly not surgery at that point in time. But as we go into that higher range, that more severe obesity, then you do want to think about surgery, especially if they're having the comorbidity, because this really can be a life-saving, extending life type of treatment, as we looked at one of the earlier slides talking about years of life lost. So often not sufficient. Now let's go on to the next slide. And what is that gap in coverage? If you go ahead and you say most patients who are appropriate for these anti-obesity medications, which have been approved by the FDA, I know we're hearing a lot about what's FDA approved versus FDA EUA. These are true FDA approved medications that have gone through all the normal review and testing and controlled studies. So these are truly FDA approved medications. But these are the study in which less than 1% of those patients who were eligible and met the criteria for anti-obesity medications were actually treated with them in most cases. So there's something missing. Why are we not thinking about that? Surgery is good for some, diet, exercise good for others, but there really is that middle ground, the less invasive, more effective, that needs to be included in your armamentarium to treat the obese individuals. Next slide, please. And this back again says pretty much the same thing I mentioned earlier, 5 to 10% can lead to reductions in type 2 diabetes, in blood pressure, in cholesterol measurements, in sleep apnea, and fatty liver, and joint pain and osteoarthritis. And in another study, that diabetes, 54% to 76% when compared with a placebo. So treatment will make a difference, and it does not need to be that significant of a weight loss to actually have an impact in healthcare and comorbidity. Next slide. So again, the anti-obesity medications, they are non-invasive. There are some morbidity, mortalities, complications, risks of an invasive surgery. And as I mentioned, not every diet, exercise is going to be sufficient. So yes, weight loss 16 to 23%. That's what you need when you really need to have that significant weight loss. The lower amount, 2.6 to 4.1% of average weight loss you can usually get with diet and exercise. So the lower BMI is fine. But it's that middle group where we really hope to get a more significant 3 to 9% of weight loss in that kind of in-between BMI obese individual, but not severely morbidly obese. And next slide again. So what is the recommendations from the American College of Cardiology, the American Heart Association Task Force on Practice guidelines on when to consider medications if they failed lifestyle therapy? If they've regained their medication, regained weight after having been successful with lifestyle therapy. And maybe it's time to do something else that may help get them jump-started, to help get them going to lose that weight again. And certainly if there's weight-related complications, comorbidities we mentioned earlier, this is also where you may want to consider, depending on how obese the individual is, to try the anti-obesity medication prior to going to surgery. Next slide. Now, what are employers doing and what can employers do? Next slide, please. A lot of employers are doing a lot of really good things. They're doing the health screening, the weight loss programs. Bariatric surgery, interestingly, is often covered. Health coaches, some have healthy food, but not as much as I'd like to see. The counseling, fitness centers are great, but again, not enough and not for everyone. Those who are severely obese may not have the motivation or the ability to truly enter a fitness program as they are on a given day. Only 55% right now are covering the prescription weight loss medications. And the benefit of having a prescription weight loss medication over an over-the-counter one is you have the interaction with the healthcare team. You have that additional support from someone who understands, who can really monitor if there are any side effects, and many of the over-the-counter weight loss medications do have side effects. So it is useful to have that partnership with the healthcare providers. And there are a lot out there who do understand obesity management as part of their practice, or even as a primary focus of their practice. And then there are some who have incentives for achieving a healthy or improved BMI or just being healthier overall. Next slide. And this is just a really important statement. If there's no coverage for weight loss, whether it's visits to your healthcare provider, whether it is that behavioral therapy, whether it is the surgery, whether it is the anti-obesity medications, individuals are not going to get treated. If it's not covered, they're going to bypass getting the appropriate treatment for this chronic medical condition. So it's important to change that messaging. Not that you can do something about it, but there's something that can be done about this medical condition, and yes, we include it in your health care coverage. So next slide. Probably could show you lots of slides, and I'm sure many of you have much more knowledge than I do on healthcare benefits. But just really quickly, one simple thing that you can do is, rather than being an opt-in where it has to specifically be added, whether it's on a ride or whether it's on an addendum, if you have to actively request, say, please add this in, then it's probably going to be forgotten. On the other hand, if it's an opt-out type of program where an employer is automatically in that AOM coverage, and it would just be a standard listing, then it's not going to be forgotten or overlooked. And it makes it much easier for an individual who is appropriate for that treatment, who maybe doesn't quite meet the criteria for surgical intervention, but lifestyle changes are not going to be enough to get the appropriate treatment. So that shift really could make it better and easier for your employees to be adequately treated. And next slide. So there's still a lot of other things that can be done. Talked about the risk assessments, the wellness seminars, but they have to be kind of an integrated wellness seminar. You can't just do a spot check here and a spot one there. They really are part of these are all things that are going to help your overall health. Make sure that there's, when we all get back into the office, make sure that there are healthy alternatives. If there's a cafeteria, if there's vending machines. And have fun things like take the stairs or a fun run or other weight loss related activities. And then other incentives, biometric screening, on-site coaching, nutritional counseling, on-site weight loss teams can really help and make it easy for your employees to address the obesity medical condition just as you would any other medical condition. And these activities really have been shown to be effective in reducing healthcare costs, in reducing absences, and reducing workers' compensation injuries, and increasing productivity and decreasing the really nasty, we don't like talking about the presenteeism issue, where the individual is there, but for various reasons, just really can't perform at their optimal level. So I think that was my last slide, other than my thank you slide. So again, I do thank you for listening this afternoon. I hope you were really, if you haven't already rethought about obesity, it is not just a eat less, exercise more, and let's talk about it. But there are things that can be done. And until we recognize it as a chronic, multifactorial medical condition, until we provide the resources, until we provide the appropriate treatment, and until we make certain that every healthcare provider and every employee individual understands that this is something just like hypertension, just like diabetes, that really will affect their life, will affect their health, and will affect their, as far as you're concerned, ability to work safely and productively over a longer period of time. So I thank you very much. I do apologize for the time frame, but it's been a little bit crazy lately with all that's been going on with COVID. So I thank you, everyone, and I hope you have a really great remainder of your meeting.
Okay. Dr. Hartenbaum, thank you so very much for a very, very informative discussion about obesity, and also the very useful tips and recommendations of what employers can do. You really kind of gave them a playbook for how to tackle this. And there will probably be some questions that some will have, but please, attendees, go ahead and put that in the chat box or the Q&A section that you see at the bottom of your screens. And we will make sure we can get answers for you, back to you. So let's move right ahead and move into our switch over to the next part, to part two. This is going to be the sponsor showcase, and as I said earlier, it's going to be, we're going to showcase or put the spotlight on Novo Nordisk and on Sanofi. Both are long-term supporters of Texas Business Group on Health and our educational programs. So with great appreciation, I'd like to introduce our account manager from Novo Nordisk. That would be Tom Zabaski, Senior Regional Account Manager, whose focus is on obesity, particularly in this region. So thank you, Tom, for bringing first of all, for bringing Dr. Hartenbaum to us. But I know that obesity is a key area of focus for Novo Nordisk, obviously, after today's presentation. But there are some other conditions, related conditions your company is working on, and what are you known for? And then tell us a little bit about that. And then I want to ask you about the types of resources you offer besides great educational program speakers like Dr. Hartenbaum. Tell us a little bit.
Well, Thank you, Marianne, and thank you for the opportunity. And I'd like to thank the Texas Business Group on Health for organizing programs like this. And yes, Novo Nordisk has traditionally been in the diabetes market for a long period of time, but we realize that obesity is a much bigger problem. So we entered into the obesity market to assist employers most recently, and that's my area of focus.
Well, you certainly are doing a good job of starting out with a program like this, which we very much appreciate. Are there other resources that you offer? Usually when we have this in a live setting, we would have a room, our sponsors would have exhibit tables where they would showcase some of the valuable resources that are offered. Are there some other things that you might want to talk about a little bit about what else is offered?
Yes, well, thank you, Marianne. Great question. And actually, we do have a number of resources available. We do have something specifically designed for employees or patients. And that's a program called Truth About Weight. And as Dr. Hartenbaum mentioned, obesity is a very complex disease state. And part of this Truth About Weight is for employees to understand a little bit more about the science of weight loss. And then secondly, part of this program is really speaking to how do you start that conversation as a patient or employee with your healthcare professional, because that can be very difficult at times. So part of this Truth About Weight is to assist people with that conversation. Now, specifically for employers, you can see up on the screen, this is part of a program that we just rolled out. It's called The Way Forward. And it's actually a comprehensive program designed to assist in weight management for the appropriate employees within your organization. And there's actually 5 modules in this program. The first is just recognize the impact of obesity. Second is know your numbers, as Dr. Hartenbaum mentioned. Thirdly is act now, and it's kind of a step-by-step guide to managing weight as an employer. Next is honing in on your population or your employees that are at your highest risk of these complications. And then probably most importantly is how do you measure success and what does that look like? So those are 5 comprehensive modules that are available to employers. And if you want further information on that, please feel free to send me an email. And my initials are tmz@novonordisk.com. And my cell phone is 774-210-2226. And I think that's going to be sent out after the program. And Marianne, I would just like to thank you for the opportunity and thank you for what you do for employers in the Texas market. Thank you.
Well, we appreciate what you do as well, and thank you in return. We will put Tom's information on this slide, on the link. I want to remind you that we will be sending you a link to the recording to anyone who has registered for our series. We'll receive the recordings from all 4 sessions, whether or not you sit in for all 4. And this particular slide will have Tom's contact information on for those who are interested. So our next spotlight is on Sanofi. Sanofi also is a long-term supporter of the Texas Business Group on Health and Dallas-Fort Worth Business Group on Health, and probably our other coalitions, San Antonio and Houston. So Sanofi is dedicated to supporting people through their health challenges. And it's a global company. They focus on vaccines, innovative treatments. You can read what I'm showing you on the slide. Our account manager is Russell Hanselman. He's provided this information about Sanofi and also about a valuable resource that they have been providing or producing for the Texas Business Group on Health since 2006. If you'll go to the next slide, Michelle, I just wanted to mention about the Texas Type 2 Diabetes Report. It's a powerful comparison of various aspects of type 2 diabetes in Texas and several Texas markets. It highlights financial information, utilization information, treatment, treatment information, and a host of other good, useful comparative data for type 2 diabetes in Austin, Dallas, Fort Worth, El Paso, Houston, Galveston area, Lubbock, and San Antonio, plus for the state as a whole, and compared to the national results for the cost of physician treatment, cost of inpatient hospital treatment as examples. So it's a great, valuable resource. I believe they're going to produce it again. It's an independent resource that does not use any Sanofi data whatsoever. It takes the data from the Managed Care Digest every year and puts it together. So when that's ready for 2021, or actually be for 2020 data, we'll get that out to all of our members. So thank you, Novo Nordisk and Sanofi, for your support. So this is an example page from one of the charts that's shown that compares the percentage of people who have type 2 diabetes and depression and hypertension and hyperlipidemia and obesity. So that's one example from the report. So let's move right into part 2 of our section 2 of our session. And this one focuses on the burden of obesity, but what are some of the innovative high-tech, high-touch approaches to managing obesity and its related chronic conditions in at-risk employee populations. And I'm really pleased to introduce CJ Mark. She is the Chief Commercial Officer for Vita. She's been in this business for 20 years, working in healthcare and employee benefits, and focuses on simplifying the access, lowering the costs, and improving health outcomes for a workforce. She formerly was with Teladoc and then was area president for Gallagher Benefit Services. She's very, very knowledgeable about this area, and we're excited that she's going to spend some time with us this afternoon. I'll go ahead and introduce Tara Sherman first before I introduce David, because Tara uses some of the Vita products, and she is the health and well-being strategy team with the Boeing Company. She works in the development of long-term strategy for both the U.S. employees and international employees. And she's responsible for the deployment of new programs. I imagine this one included, which you probably will talk about, and focuses on mental health, emotional well-being, healthy eating, leadership engagement, external recognition, and partnership with safety, global corporate citizenship, food services operations, and well-being, primarily well-being of their employees. So then I want to, so she and CJ will tag team on this. And then I'm so pleased to invite David Witt, who's the Employee Wellness Manager of the City of San Antonio. He has been managing the City of San Antonio's wellness benefits since 2014. And he oversees the design, implementation, and evaluation of all their health and wellness programming, and they have about 13,000 city employees. We'll talk with David a little bit about some of the ways that he's working with the City of San Antonio employees on managing obesity and other related chronic conditions. David also serves on the board of directors of the Texas Business Group on Health, and he has been a long-term member of the San Antonio Business Group on Health and in a real leadership role as well. So with that, let's start with CJ. We will have time for questions and answers afterwards, but go ahead and use the Q&A box below or at the bottom of your screen, and we'll address those at the end of this discussion. Thank you. So CJ, tell us about high-touch.
Big thank you, Marianne, to you and your team and the Texas Business Group on Health. And I hope your members are staying safe as the hurricane, in the middle of a hurricane. So really appreciate everybody joining us today. And as Marianne said, I've been in this virtual care space for quite a few years, was an early adopter. It actually embedded a telehealth capability into my disease management program in the early 2000s, which was called Being on the Bleeding Edge. So I'm extraordinarily passionate about the way virtual care can and is transforming healthcare delivery necessary in our healthcare ecosystem overall. So we're going to talk a little bit today about what Boeing's doing specifically to tackle the physical and mental health capabilities. If you go to the next screen, I think there's a little picture of Tara and I, so hello again. If you go to the next screen, this is really talking about chronic disease, and you see this as employers every single day. I'll have Tara talk in a minute about what she's seeing specifically in the Boeing employee population, but we know in our healthcare system today that about 40% of adults are living with 2 or more chronic conditions. We see this in our VITA data today. On average, those folks on our platform that have a chronic condition have 3.3 co-occurring chronic conditions. So as Dr. Hartenbaum talked about obesity being one of those chronic conditions, absolutely, and the multifactorial approach, we'll talk about that and what Boeing is specifically doing around that. 68% of adults with a mental health condition have at least one other medical condition as well. So we see that across the VITA book of business as well, as 70% of our members that have a chronic condition also screen positive for depression. So think about that. You're already trying to tackle a chronic condition and you may not be able to get out of bed in the morning. And 48% of the folks on the VITA platform that have a chronic condition also screen positive for anxiety. So this whole thing that I think you're going to hear about co-occurring conditions, about tackling this being multifactorial, absolutely true. We see that today. And then we know that of those that have multiple chronic conditions, on average, they're costing 4 to 6 times more. And I'm sure you see this in your data on a regular basis. So I'm going to turn it over to Tara to talk a little bit about what she's seeing specifically in terms of co-occurring conditions inside the Boeing population. So Tara?
Thanks, CJ. Yeah, just for anyone that's not familiar with Boeing, we are about a $75 billion revenue company. We have 3 distinct business units, and our Boeing Global Services is actually based in Plano, Texas. So we have a strong Texas connection too. I would say our demographic skews a little bit male and probably mid to late 40s. When we talk about weight specifically, we see ourselves really mirroring the greater US. So about 1/3 of our employees are overweight, 1/3 obese, and about 1/3 are at a healthy weight. And as CJ was talking about the conditions having 2 or more chronic conditions or having a mental health condition along with a medical condition, we see that definitely in our population too. I'm guessing most of you also do. And so we think it's really important to help people manage their health not in a silo, but manage these things together. When we look at our priorities at Boeing, we want to truly help our employees live their best quality of life that they can for themselves and their family. And when it comes to from a business need, we want to make sure that our employees are as productive as possible and that we're able to contribute to the bottom line. And that can come from strong ROI from programs like VITA. And like the doctor talked about a few minutes ago, we see those costs carry forward into future years when employees are able to address these conditions in a positive way.
Absolutely. Well, thank you, Tara. Tara, I can't talk today. That's the the mid-afternoon thing. So if we go to the next slide, Tara, I was hoping you could talk more specifically about how you're deploying this polychronic condition management approach inside Boeing. So, and how that's cascaded, and kind of some of the tips that you have with regard to that.
Absolutely. Well, a couple of things. I'll kind of cover this slide and then how we've introduced the program. I think that when we were looking for solutions, what really stood out to us, and I think as others look at digital solutions, is what's right for your population. We love this solution because of the breadth of programs that are presented. We think that's really important because employees don't always know exactly where to start, or it might not seem where we would say from a care path you would want to start. So maybe I'm not ready to lose weight, but I know I need to clean up my eating. Well, then there's a nutrition program. So programs like VITA that have the breadth can really help meet an employee where they're at to start making these steps. We love the connection of technology and a coach. I think that's really important too, that there is something that supports individuals, but also there's a real person on the other end. And that makes a real difference when we're talking about accountability and someone to understand and someone to help meet challenges. We've done a lot to really bring this program to life at Boeing. We've done some of your traditional communications that you would see in a site or on an intranet, but we've also had many VITA health coaches out at our sites. This is pre-March, how things have changed, but to really show people there's a human being behind this program. This isn't just an app. There's real people here to help you, to help support you, and see you through this. And we think that that's a big enhancement to helping people access the care that they need, and that's one of the items listed here. It's not always easy to get the care that you need, whether that was years ago going into a meeting, kind of a support group for weight, or even getting into your doctor on a regularly occurring basis. It can be really challenging. And so having healthcare in your pocket is something that is really useful for our employees, and we've really tried to capitalize on.
So very insightful. That reminds me of something that one of our providers recently said, Tara, when you talk about that kind of human touch and the robust technology. This provider actually literally said that combination of AI and machine learning really allows providers to have bionic capabilities. So, it's that combination, I think, that helps us to be able to really connect in a very human way, but it arms the providers so that they can be even more effective as they deploy those evidence-based clinical care protocols and programs. So if we go to the next slide, let's talk a little bit about this kind of cycle. And I think Dr. Hartenbaum touched on this as well, right? Which is, we know that there are folks in the population that may have depression, anxiety, stress. You touched on this before, Tara, unhealthy habits, the poor sleep, nutrition, low exercise levels. I just read a statistic that alcohol consumption went up 55% during COVID-19. I must confess I'm having wine more often with dinner right now myself. So if I continue on that path, right, that could lead to weight gain, and which is, leads to chronic conditions and kind of this reactive medicine-based care. And obviously, there's always a place for the pharmaceutical intervention as well as part of this whole continuum. But can you talk a little bit about how members can come in? I think you touched on that briefly, how members can come in depending upon where they are in this whole cycle. So whether it's anxiety or they're trying to tackle, and you talked about the nutrition piece. Can you talk a little bit about the mental health component of that as well?
I sure can. This was a huge draw for us too. I think that we all continue to fight the stigma that is associated with mental health, and I think as a society we've made a lot of progress. But it's still not always easy for people to get the help, and then we talk about getting access to care, whether it's getting to an appointment. Many therapy appointments are reoccurring, so sometimes that can be really difficult, or even finding a provider. And so we loved seeing that there was a mental health component and program offerings in VITA right alongside things like weight management and hypertension and other programs like that. For many individuals, I have a firm belief that stress is kind of like an entry into mental health support, because it's almost fashionable these days to say you're stressed. Everybody's stressed. I'm so stressed. I'm really stressed. I haven't been this stressed in a long time. It's not great, but it's very easy for people to say. And so sometimes it is just stress. and we can get some support early on and kind of limit it from growing. And sometimes it's more than stress, actually. Sometimes it might truly be anxiety, the way we're describing stress. And so the VITA onboarding process helps to get people into the right program, but never forced. So a program will be recommended, and employees have the option to take that recommendation or to seek another program. The other beautiful side to starting to address some of this mental health is someone may, let's say they get an anxiety program recommended, but they're not, at that point, they're not ready to go down that route yet. Maybe they sign up for weight management, but if the coach recognizes some behavioral health or mental health needs, they can invite in a specialist for a coaching session or incorporate that in another way so that employees are starting, with their permission, of course, to get some of that support, which we have seen bring so much more success to the movement people are working hard to make in weight, nutrition, physical activity, and some of those other areas.
Yeah, absolutely. I mean, it's interesting to hit on something you said, as you talk about polychronic people in the population, and you have a predominantly male population, and, nothing against the males out there in the audience, but men tend to not, even if they might have something, happening from a mental health perspective, they don't tend to come in for a mental health condition, but they might, I think you touched on this, they might come in for poor sleep, and they can get referred then to a therapist to help them tackle depression or anxiety. And I like the way you touched on the ability to come in at a subclinical level for those anxiety and stress, and then maybe tackle something that is deeper in terms of depression that is actually clinical in nature as well. So that really resonated with me. I think if you go to the next slide, this really shows a lot of the data around this, right? So treating the body and mind together, in other words, the physical and the mental health together, this is true outcome data. Our clinicians obviously love this. And you can see that as you tackle the dots, which, the metrics in terms of weight loss, the metric in terms of depression, that they're both declining together. So, can you talk a little bit about the data that you're seeing at Boeing around that as well? And as you see those co-occurring conditions, and you see the reductions as you tackle them both together.
Yeah, so we are seeing a really strong connection, and we are seeing our employees that have more than one chronic condition working with VITA. It's kind of like I touched on a little bit earlier. We're not really, as human beings, we're not a condition or a silo, and so it's really important to address these things together. And I think any of us in this meeting that have struggled with weight, I have over the past 10 years, it's not easy. And I think when we really stop to think about it and progress, as we've seen some of the research and evidence progress in the past years, it's not just a calories in and calories out. And there's many reasons why we eat or don't work out, or whatever other pieces may be involved. And we've really got to look at this whole person. We've got to start handling things together because it's not easy, and we're complex beings. And so the support that we can give people from a mindfulness perspective or from a mental health perspective can really help start chipping away at some of those behaviors and take small steps to make improvements that then can lead to really fantastic outcomes. And we've seen and heard from some of our employees. That's been one of the most rewarding parts of my job, and probably many of you would agree, is when you introduce a program and you get to hear from employees that the program has changed their lives. And it's always great to hear about the weight loss, but for me, it's been really, really meaningful to hear about the mental health pieces and people making that connection and making progress. So I think we can't underestimate that.
Absolutely. So if we go to the next slide very quickly, because I want to make sure we wrap this up and give David lots of time as well. This is really just talking about the trends in terms of demand for virtual care, even before COVID-19. So this was data from National Business Group on Health and the Bankrate Healthcare Survey, looking at the top initiatives. I know Dr. Hartenbaum touched on this as well. I will say that having been in this virtual care marketplace for lots and lots of years, I think about, Tara, where we were even 5 to 6 years ago when we were saying this person would never use virtual care, right? And how that's changed. It changed gradually, but I think it's changed overnight. So I'm sure you're seeing this today at Boeing as well, a higher adoption rate.
We are, yeah. I think COVID kind of forced all of our hands as users. I know I certainly have used more telehealth over the past few months, and I think it will be interesting to see how much stays. I think we'll probably have a little bit of variability before we stabilize, but I would expect to see us stabilizing over pre-COVID rates.
Absolutely. And if we go to the next slide, this again is just talking about the acceleration of virtual care adoption. 76% of consumers surveyed now are saying they're interested in using telehealth or some kind of virtual care. And if you go to the next slide, this is really talking specifically about the Boeing weight loss program and the outcomes that Boeing is seeing. So Tara, if you could kind of address that, that would be fantastic.
Absolutely. So what we wanted to show you all here is the most meaningful outcomes. So anytime we have a digital program that's free for our employees and easy to access, we get a big take up, but we want to look at the ones that are truly committed. And so we have looked at that group by those that complete at least half of the coaching sessions. So it's roughly an every other week coaching session. And we've seen 5.5% weight loss of this group of over 100 employees. And as the doctor mentioned earlier, between 5 to 10% of weight loss means really statistically significant disease risk reduction. So we're really pleased with that. We think the coaches really make a difference and bring that accountability for our employees.
Absolutely. And if we go to the next slide, this is really talking about CBT program therapy and in reductions and meaningful reductions in depression and anxiety. So at baseline for members that have at least one consult or are sent 12 messages and who were enrolled for at least 8 months, we're seeing at baseline that 52% reported mild anxiety and 47.3% reported moderate to severe anxiety. And we saw 52.4% reduction in anxiety by program month 3. And they maintained that through the end of the program at month 9. And again, one of the reasons why I'm so passionate about virtual care access is this ability for the member really to engage. They don't have to have a therapy session every single week. If they want to have ongoing therapy sessions, they can do that. They can engage through text and messaging also with their provider on an ongoing basis. And at baseline, 59% reported mild depression and 41% reported moderate to severe depression. And we saw a 38.4% reduction in depression by program month 3, and they were maintaining that through month 9. So again, it's really about sustainable outcomes. If you talk with our clinicians as they design programs, one of the things that I would say that they came, before coming into virtual care, frustration in terms of brick and mortar is that members would cycle in and cycle out. In other words, they'd come in and do therapy, they'd cycle out, and they weren't actually seeing meaningful reductions long term. So this ability for members to really come in and out and have ongoing access, I think really makes a difference in terms of baseline. So do you want to talk a little bit about that, Tara? And then I'll kind of move things along here.
Yeah, so we actually just did an emotional well-being and mental health survey on our employees, and we did hear that that getting into care is challenging for people. So we're still working to kind of shift that I guess that traditional view that you do need to go in for care and move people along into some of the opportunity that exists in a virtual environment. They're able to do it at their frequency and have the support in between those meetings, which I think is also really important. When you bring in a digital tool, you not only have that CBT or your sessions with your therapist or coach, but you've got additional tools with you all the time, whether it's a thought tracker or some other tool. It's there with you in between those sessions. So you're starting to build up the tools that help yourself. And I think the really cool thing that I'd like to point out on this chart is we saw a spike in anxiety and depression, and we've noted that we think that's due to COVID. And then we also saw it drop again. So one thing I'd say is we're probably hard pressed for any of us to say that COVID didn't impact our mental health in some way, shape, or form. And so what's really meaningful here to me is our employees that were in this program, they had that uptick, just like many of us probably did, but then we're able to utilize the tools and resources available with them to stop that trajectory and be able to go back to a reduced level of anxiety or depression.
Absolutely. So I know that Marianne, we want to make sure we get to David. We've got, just a couple closing slides. If you want to go to the next slide, which is obviously we've been talking about every mental health condition being, impacted, impacts physical health. That's clear in the data. You saw that with Dr. Hartenbaum as well. And if you go to the next slide, as we talk about COVID specifically, I think we all know this intuitively or at a gut level. Virtual care will continue to improve. Hopefully we'll get a chance to talk about this in more detail as connected device information continues to improve, this ability to connect on the fly. This ability to be able to take analog to, Terry, you talked about this before, even take an analog device and upload that information into a digital environment for tracking so that it gives that bionic capability to providers so that they have that information on an ongoing basis. That quick access you talked about, the rapid and sustained clinical outcomes, absolutely critical. Consistently high engagement, that's been one of the, we've been talking about engagement for years. It's the bane of our world and employee benefits. And then obviously you want to make sure that we have sustained high member satisfaction. And I'll turn it over to Marianne to kind of kick it over to David.
Thank you very much, CJ and Tara, for a really interesting discussion. I was excited to see how that ties in with actually session one, where Mary Beth Gray talked about the technological advances that are being applied in healthcare. It's just we're in for a roller coaster ride of developments in new technologies and new applications, and this sounds like a good one. Very interesting story, and thanks for sharing about Boeing's experience with this too. It sounds like you have a good handle on things. But not every company is able to or has gone into that type of a high-tech, high-touch, personalized health for health management. But they do try other things. And David Witt with the City of San Antonio has done marvelous work with the city employee wellness programs. And David, if you'll tell us a little bit about that, and it may not be the latest and greatest high-touch AI applications and predictabilities, but I know that I've heard and you've told me before about some of the really cool things you're doing.
Absolutely, absolutely. Well, you kind of hit the nail on the head, Marianne, in regard to some of that high-tech stuff and it not really being applicable to a large number of our population. From a demographic perspective, we have approximately 13,000 employees that serve the 7th largest city in the United States. It's comprised of more than 1.5 million citizens. But with 38 different departments, obviously comes a wide variety in our population, much like the city that we serve. So we're talking from blue collar staff at our solid waste and public works and parks and rec departments to our brave first responders at San Antonio Police Departments and Fire Department, librarians to judges, building maintenance to pre-K teachers, and so many more. Each population is a sort of corporate community of itself. For a number of our employees, English isn't even their first language. A lot of our employees don't have access to the internet at work or home, much less know how to use those tools. And that creates an unfortunate digital divide among a large portion of our population. But in short, we're a very large employer with our employee demographic being all across the board, which certainly doesn't make our jobs any easier. But and from a health perspective, as you might imagine, we closely mirror that of our community as a whole. Obesity certainly has not forgotten about us, nor have the chronic conditions associated with obesity, including diabetes, hypertension, heart disease, sleep apnea, musculoskeletal issues, you name it. But we're in for the long haul. And so next slide, I wanted to just kind of share a photo of our team. And so there's three of us, myself and a senior analyst and an analyst that are employed by the city. And we also contract out 3 Blue Cross Blue Shield of Texas health coaches. And a very important part of what we do is treating those coaches not just as any other contract employee. They are truly a part of our team. They're part of our strategy. They sit at the table with us and come up with ideas. They share stories that they're seeing out in the trenches. So it's a very, very important part of what we do. Next slide. Really quickly, I wanted to talk about our program history. And you'll notice a few things as you look at this timeline about the growth of our program. I'm not going to talk about every single one of these, although I could go on and on and on about each of them. It would warrant their own presentation, but a few things of note I've highlighted here. Back in 2007, it was when we first established the wellness program, which marks the incoming of our city manager at the time, Cheryl Scully. And she made it a point to establish the wellness program and start addressing wellness among our employee population. One of the big things there was the city manager's 5K walk and run event, which is still going strong today. Started out with 300 people at one of our local parks and has now grown to over 3,500 participants. Now, of course, that was pre-COVID. This year, we're doing the event virtual, so we'll see how that goes. Should be interesting for sure, but that event is kind of our way of coming together to celebrate all of the efforts and the city's commitment to the well-being of its employees and their families. We started offering fitness center discounts around that same time as well, and then progressed to offering employee health kiosks where our employees are able to check their blood pressure, their weight, their BMI, and now they can even check their body fat percentage. Of course, lunch and learn sessions, which are, very standard part of most programs. But those lunch and learn sessions have grown throughout the years. We've started to address, much like our programs, as you'll see across this timeline, start to address more than just simple things like diet and exercise, although those will always remain foundational elements of health and well-being. We start to, develop things that focus on mental well-being, mindfulness, just thinking outside of the box. And so in 2011, 2012, we added our on-site health coaches that are still there today. We started also offering discounted diabetes medication, and often those medications are actually provided free of charge to help our folks manage their chronic conditions, namely diabetes. A big hallmark that happened in early 2013 was we started a relationship with Virgin Pulse, and we still offer that program for our employees today. Essentially, we put our money where our mouths were, and we started incentivizing folks when they, along their well-being journey. And so with the Virgin Pulse platform, we outfit every single one of our employees with a free pedometer to track their steps. And they can earn up to $500 a year in the form of an HSA or FSA contribution. Unfortunately, that's been put on hold for the next fiscal year due to COVID-related issues, but we are looking forward to that coming back, and the program will still be will still be offered despite the fact that there will not be an incentive tied to it. And then what you start to see around this time frame is that we started looking at creating a culture of well-being. And so one big part of that, you'll see highlighted there in 2013 or 14, was we added wellness to our directors' employee performance evaluations. And so every single year since, we have asked the directors of each of our 38 departments to write a memo and tell us how you have supported the health and well-being of your employees. And so what that does is that creates that top-down approach and makes even these directors know that we mean business. The health of our employees is incredibly important, so much so that it's tied into your pay increase every year. And so we every year sit down, a committee of us, and we grade those memos and we score them, and those scores are directly tied in part to their annual raises. We also started in 2017, we started working with the Livongo Diabetes Program, which has been a huge success. And then we started really focusing at that time on branding and communication. So we created the COSA Well program and really kind of just took standard communication and marketing approaches to everything that we did. We felt it was very important not only to provide the tools and resources, but to communicate the importance of those tools and resources under a recognizable brand. And so I'm even wearing my COSA Well shirt right now, and you'll see that logo kind of appear everywhere, you know, again, as part of our culture. And then even recently, we've worked with our Metro Health Department and created a healthy food and beverage procurement process. And so this is an administrative directive of the city, which means we mean business. And you know, there's no more just ordering pizzas and burgers for meetings on site. You have to offer a healthy option, which we felt was incredibly important to at least offer something for folks. And so I won't get into all the details there, but in short, we are making sure that a healthy option is always available at work meetings and work parties and things of that nature. And then, of course, in the future, we've got some things coming down the road. We're moving to a new headquarters across the street, and we're really looking at changing the built environment. Now, San Antonio, many of you know, is kind of spread out. You know, we're very geographically dispersed as an employer as well. We've got over 120 something locations, maybe more across the city. You know, but at our headquarters, we want to change the environment and feel that all of the other locations will kind of follow suit with that. So we're looking at building a wellness center, an on-site wellness clinic, downtown walking trails, and a lot of different things that will help to change that built environment. But, you know, all of this, I want to go back to a point I was making earlier. It's incredibly important that we create a culture, right? And you hear that term all the time. But, you know, we offer a lot of components, and, you know, you could see that we offer a robust variety of resources to aid them throughout their wellness journeys, wherever they may be along that journey. But offering programs is only one piece of the puzzle, I feel. And so before your program can truly be effective, you must simultaneously and continuously be striving to migrate toward that culture that prioritizes well-being. And trust me, I know that talking about culture and creating a culture among 13,000 employees is two completely different things, right? But, you know, a culture shift does not happen overnight. And we have to kind of remember that as we're looking at data, you know, and we might see some consistent increases in these chronic conditions. You know, we hope to flatten those and eventually reduce those, but without creating that culture first, we don't feel like that's really going to happen. And so for us, with 13,000 employees across 38 departments that each have their own individual cultures within them, we don't kid ourselves by thinking that we can truly understand and effectively address each and every subculture that exists among our population. It's just never going to happen. But this is where you go directly to the source, in my opinion. You know, for us at the city to help us, a major strategy that we use is our network of wellness ambassadors, or some employers like to call them wellness champions. You know, these are the folks that are living within their individual worksite culture and who understand what specific barriers exist between their coworkers and their coworkers' progress towards a healthier version of themselves. And so, you know, I encourage you to speak to your employees more than anything. Ask them what's working and what's not. Ask them what's missing and how you can improve your program. These are your people, and they're not going to change just because you tell them that they should. You know, they need to want to change. We have to meet them where they are. And at the end of the day, we have to trust that they do want to make positive changes that improve their lives, both at work and at home. So even if it's on their own terms. So listen to them, provide them the tools and the resources that they need, of course, and allow them to help guide you as you make your workplace one that truly, truly embraces well-being.
David, thank you so very, very much. That you have a very comprehensive program and a great plan, a progressive plan. So it's quite impressive. There was one question about how you measure the ROI on the cost savings, other than all the other wonderful improvements that are happening.
That's a great question, Marianne.
The only question I have, so.
Well, and it's a good one, and it's one I've been hearing my entire career in this field, you know, and it's not an easy question to answer, and I don't know if it really ever can be answered. You know, what is ROI or VOI, you know, value on investment? You know, there's so many factors that Dr. Hartenbaum even touched on: presenteeism, absenteeism, and for an employer as large as us with so many different components and factors, not only in our wellness program, but our risk management department and other aspects of us as an employer, it's impossible, in my opinion, to truly come up with an ROI. We employed strategies to come up with ROIs. We hired a company called Benefit Science to help us determine an ROI, and it showed a 1.89% ROI, I think, at the time. But, you know, I don't put a lot of weight, no pun intended, into ROI, because at the end of the day, as an employer, we have a responsibility to take care of our employees. Does it really, really matter if we're getting back $2 for every dollar we spend, or maybe we're getting back nothing? Does that mean that it's still not important to provide these resources to our employees? Of course it doesn't. These are incredibly important benefits, you know, that not only help with the health and well-being of our employees, but it also helps us as an employer attract new talent, retain talent, and all of those other components as well. And so, you know, in short, we don't really focus on that anymore. We will look at things like engagement, enrollment. We look at data. I don't want to give the impression that we don't look at data. It's important. It helps guide your programming efforts, but my advice would be not to put too much weight into that. And now I know that, you know, you may have a CEO or a CFO that's demanding an ROI, but, you know, you always hear in regards to wellness how important it is to have that top-down support. And we are very lucky at the city to have that top-down support from the mayor and council to the city manager, all the way down to our wellness program. And so, you know, again, if they don't understand that, I would encourage you to do your best to try and help them understand, again, that we have a responsibility to help our employees more than an ROI.
I just couldn't have asked for a better response. Thank you very much, David.
Absolutely.
If we were live, we would all be clapping.
Yeah.
So, with that, this concludes our program. I'm sorry that it ran over just a tad, but I hope that you found it worthwhile as much as, I mean, I've copious notes already. So, but feel free to send us email questions if you have any on that. And I apologize that we didn't get through all of the questions that you may have had. So we're open to it, and we'll be happy to respond. Just a reminder that our next session number 3 will be next Wednesday at noon. And this actually is such a great tie-in, a two-tiered strategy to support employee mental and emotional health during and beyond COVID. It ties in so well with what we learned today in today's session, and also in yesterday's session on the strategies for 2021 in the new normal. Anyway, so please join us tomorrow. I'm sorry, for next Wednesday and also next Thursday for the final discussion about emergent strategies to incorporate social determinants of health. All of these tie together. They're separate sessions, but the tie-in is just remarkable. So thank you so much, all of our speakers, CJ, Tara, David, and Dr. Hartenbaum, since she's left. We really, really appreciate your participation and your input. A reminder that on September 24th, we have part 1 of a cancer care symposium. You all should have received our first notice of that. They are 2 separate registrations. Part 2 will be with 3 workshops on prevention and early detection. Coordinated care is workshop 2, and survivorship and return to work is workshop number 3. That will be in the morning of October 15th. One registration is, once you register for one, you can entitled to go to all, but I think there are probably 2 ways to register for each one. More on that coming. Thank you again. We'll see you all next Wednesday, I hope. And in the meantime, have a wonderful weekend and stay safe, stay healthy, and stay engaged. Thank you.